Well, good morning, everyone. Happy Friday. I'm going to go ahead and call our meeting of the Durham Recovery and Renewal Task Force to order. This is the second meeting of our task force. And we've got a very full agenda today, so I'm going to actually have us jump right in with our priority update, which is an update from the mayor on our state and local orders. Mayor Schewel?
Thank you. Can you hear me, Katie?
Yes.
I apologize to you all. Had a little technical difficulties this morning and I hammered away at it a while, and I appreciate Amber saving me, so thank you. I'm going to first call on our County Commission Chair, Wendy Jacobs, to give us an update on where we are in terms of our public health that has caused us to make the choices we have regarding our stay-at-home order. So, Wendy, why don't you do that, and then I'll describe the order.
Thank you, Mayor Schewel, and good morning, everyone. Great to see everybody's faces. So we will be coming out today with our revised order in light of the governor announcing phase 2 that will be starting today at 5 p.m. And of course, our order is based on the governor's order, and the mayor will be speaking in more detail about that. And we have consulted with members of the leadership of our task force on our next steps. But the most important data for us to guide our decision making on is the public health data. And we, as you know, our public health department has done a great job tracking data, and it's available at our data hub every day. And we've also had the benefit of epidemiological modeling data from Duke University that we get every 2 weeks. Unfortunately, the modeling that we got for May 4th through May 19th and that we got on May 20th showed that our rate of growth had actually more than doubled in 2 weeks. And so we had gone from, on May 4th, we had a 1.4% rate of growth. And on May 19th, we were actually up to 3.7%. In comparison, the state's overall rate of growth for COVID, positive COVID cases is now 2.2%. This is actually the first time since we've been receiving this modeling data that we're exceeding the rate of growth of the state. And, you know, if you've been tracking the numbers in the past week and a half to 2 weeks for Durham County, you may have noticed that our numbers were increasing more rapidly. We do know from Rod that there has been an uptick in our Latinx population. That's possibly one factor. The other issue is, of course, that we're doing more testing. And so when there's more testing, there's going to be more positive cases. One of the data points that we don't have that we're going to all talk about on this agenda, really important function of this task force, about what are the data points that we need to measure what's happening as we reopen, is we need to understand how many tests are being done every day in Durham County, and we don't have that information right now so that we can put this trend into perspective. So just looking at, you know, where we are at this moment, trying to understand what is happening in Durham County, also comparing ourselves with our neighboring counties. For instance, our rate per capita is 3 times of Wake County. And it is also above, you know, Orange County, and Mecklenburg as well. So again, we have to look at our data, our trends, and that is with the caution that we have taken in with our next steps related to phase 2. And I will let the mayor go into more detail, but I just thought it was really important, I think the mayor did too, just to share this most recent trend, which is honestly different from what we've been seeing all along. And this is not to say that the residents of Durham have not been doing a great job, and that all the efforts that people have been making have not been effective. Again, we have to understand what's happening and be cautious. People in this community have been doing an incredible job, and people have made incredible sacrifices. And we want to recognize also the data that we get from our Emergency Operations Center shows that people are abiding by the stay-at-home order and are doing that. Again, we just need to understand, as we reopen, we want to be able to stay open. That is really, really important. We want to create the conditions so that we're not going back and forth. We're not reopening and then pulling back. It's really, that's not going to be good for our economy either. And so today we'll also talk about the, and I think the mayor will talk about this, and Ryan, but the Durham Gold Standard and our voluntary self-certification efforts that we think are going to help lay the foundation for reopening our restaurants and our pools and our personal care salons, so that we can ensure our public health and safety, and also give people confidence that they can receive services and support our businesses and support our employees, and people can feel confident about that. It will give a tool to our businesses to help provide that confidence. So I will now turn it over to the mayor, and then we can answer any questions from the task force members.
Thank you very much, Wendy. And Wendy laid the groundwork for exactly why we have made the decision that we have to be a little bit more cautious than the governor in issuing our stay-at-home order this morning. Let me just very briefly describe to you all the differences between our order and the governor's order, which I think is important for people. And we want to try to make it as clear as we can so we avoid as much confusion as possible. As you all know, the governor's order will go into effect at 5 o'clock this afternoon, and it will become a safer at home order. He's still strongly urging everyone to stay home unless they're essential business that they need to conduct outside their homes, but that's still the strong message. Stay home, socially distance, wear a face covering. All of the things that have been the previous public health messages continue to be those same messages to keep our state safe. The governor has the significant change in his order is that he is now allowing, as of this afternoon, restaurants, personal service businesses like salons and barbershops, and swimming pools to reopen. The biggest difference between our stay-at-home order, which we are promulgating this morning, and the governor's order is that until we are keeping those businesses closed until 8 a.m. on Monday, January the 1st. 8 a.m. on Monday, January the 1st. And that
is that, can we get a clarification? Is that January 1st or June 1st?
Thank you, Katie. June the 1st. Yeah, January the 1st will be a little long. Monday, June the 1st at 8 a.m. I'm glad I didn't scare everybody by that. Thank you, Katie. That could have been a good headline. Monday, June the 1st at 8 a.m. And those businesses will be able to reopen at that time. There are a couple of other differences between our order and the governor's order, which I do want to mention. One is the governor has gone to, for mass gatherings, has gone to a limit of 10 people indoors and 25 people outdoors. Our order continues to have no indoor mass gatherings and a 10-person limit outdoors with non-household members. There are a couple of other differences. One is that The governor has a 10-person table limit on restaurants, and we have gone with the DHHS guidance for a 6-person limit. We appreciated that guidance. And those, I think, are the most important differences. We've also modified in our order the real estate information, and we are now allowing in-home showings of occupied homes by agents, and agents can accompany buyers, and they can also accompany licensed inspectors as well. Let me talk about one other very important aspect of this, which Wendy mentioned, which is self-certification. As a part of our order, we are asking businesses to join a process of self-certification. And I want to really thank Marielle Beasley, who's on this call, and Ryan Smith. Marielle from the Center for Advanced Hindsight gave us some really great ideas to improve our thoughts about this, and I'm so grateful for that. Self-certifying means that businesses are voluntarily agreeing to follow a set of best practices based on guidance by public health experts for reducing the spread of COVID-19. Businesses will have the opportunity to demonstrate they've self-certified by publicly and prominently displaying at their place of business a checklist of safety guidelines that the task force will develop in collaboration with local experts. And we're going to need the help of our task force and our roundtables here. The checklist will include both a common set of best practices that we expect all gathering places to observe, the best practices that you all are well aware of, social distancing and hand washing, that kind of thing, as well as industry-specific practices that would also be useful for that industry. So for example, if it's a restaurant, what are the things that particularly will keep restaurants safe? And these will be included on the checklist that the task force and the roundtables will help us develop. The important thing to know about this process is that it's voluntary and it will not delay businesses from opening who are able to open under local orders. The goal of our of this work is to release this process before June the 1st. The process will entail downloading and printing a self-certification checklist for whichever industry is involved, and posting it prominently in the place of business where all customers can see it upon entering. The checklist, the idea behind the checklist is it'll serve as a reminder to our businesses of the practices that they're committing to follow. And most important, it will encourage accountability to business patrons and their employees who will know that what they should expect upon entering the establishment. We believe it is, as Wendy said, one of our mottos this week has been be able to open and stay open. And one of the ways in which we think we can do this is to provide these best practices, to encourage our businesses to have these best practices, and to give our customers, our clients, confidence that when they enter a business, they're entering a business that is safe. So that's the meat of our order, and happy to take any questions or hear any concerns that you have, or whatever the chairs deem is appropriate at this time of the agenda.
Are there any questions for either Mayor Schewel or Commissioner Jacobs?
Thank you.
Thank you very much. I'm going to turn it over to Maticia to walk us through talking about our priorities for this week.
Yes. Thank you, Commissioner Jacobs and Mayor Schewel. Good morning, everyone. If you think back on our guiding principles, one of our guiding principles is to act with a sense of urgency. And given the fact that we're going to have some places that reopen on June 1st, there's a lot of work that we need to get done, I would say within the next week, because a week from today is May 29th. So I wanted to spend some time talking about those immediate things that we need to start working on as a task force. We likely won't be able to solve for all those things today, but I think we can talk about those items and determine who's on first to kind of lead those items forward. There's a couple of things to the rate of growth from May 4th to May 19th. May 19th. That was pretty alarming. So as a task force, I think we need to spend some time thinking about, you know, what is the metric or metrics are we going to use to help us determine, are we on the right track as we reopen? Because we don't want to reopen and then have to close again. So I want to spend a little bit of time talking about how do we go forth with coming up with some metrics to really help us understand if we are in an acceptable tolerance as it relates to rate of growth and any other thing that we think is important. Also, I want to spend some time talking about the self-certification process, because that's work that needs to be done pretty quickly, and talking about it from the perspective of restaurants, pools, as well as personal services. So why don't we just start with, let's say restaurants, because I know there was a roundtable, I think on yesterday, and I know there's already been some work that started as it relates to restaurants. And I'm gonna ask maybe Susan if she wants to share anything that came from that roundtable, and let's just talk about how do we move that self-certification process forward. And let's have a conversation also about what do we as a task force need to do collectively to help push this forward.
Yes, restaurants did have a conversation yesterday, and we had Lynn Minges, who is the president and CEO of the North Carolina Restaurant and Lodging Association, speak and share with the group the Count on Me NC program, which NCRLA in conjunction with Visit NC is putting forth. And it's a similar concept to what we've discussed here, in that it is a program of self-certification in terms of businesses committing to follow a set of guidelines that have been endorsed at the state level. In the case of that program, they are actually offering training in 5 different modules for different components of restaurant workers, for example, front of house, back of house, cleaning staff, that sort of thing. And I think the reaction, we had a very large group on the phone yesterday for the restaurant roundtable, so it was too large to be highly interactive. We did get a lot of comments and questions in the chat room that we are going to follow up on. And what I've heard is there's still questions, but I think there was a idea that it would be a good idea to adopt the same set of standards that are happening at the state, and maybe perhaps with a modification specifically to Durham, but getting to that level of specificity over the next week and making sure that we've got the group aligned, I think is going to be very important. There are a lot of other issues and questions that the restaurateurs have brought up that they're very concerned about, but specific to this topic of self-certification, I think we've got work to do, but we're on the right track with that. Other issues, however, have to do with the opportunity for expanded outdoor dining and what happens with the ABC regulations, whether there are opportunities there, and then what kind of financial support is available for the restaurants.
Okay, thank you for that, Susan. I know we have the roundtable, and it sounds like the roundtable is making progress. Is there any support that you think that roundtable needs from any others that are on the task force?
Yes, and I believe we have the people involved. Certainly Nicole and DDI have played an enormous role in this, more so than I have, in working with downtown properties on some of the issues that are so important to them. And Brian Fox has been very supportive, and I know that Jeff Durham's been involved. So I believe we have, and hopefully I haven't missed anyone, but I believe we have the right folks involved from the task force. I think the next step is how to take, given that this group is very passionate about, and they are facing enormous challenges right now, and they recognize they're going to need to invest in PPE and in some cases physical modifications of their space. It's one thing to just put a closed sign on a table. It's another if you have to really restructure your space in some ways, and involves time and money. So I think that the trick now over the next week is going to be how we solidify some of these things, get the information out, create these checklists that they can use, and help them get ready to go. Plus working on the regulatory things that I spoke about earlier. Are there others who were part of that rest have some things you'd like to add?
No, I'd agree with that. I was watching a couple of meetings at one time, so hopefully I'll focus on the restaurant and not the other meetings. But Zoom on a couple of different screens, that's a lot of fun. If you all haven't done that, try that. So it's a lot of fun. But I would agree with Susan's assessment. I will say that the safety issue came up. How do we know what is safe? That came up quite a bit. There are a couple of restaurants that are very focused, and rightfully so, on that. And are there standards that are out there that have been kind of cookie cut, whatever? And do they really apply to what applies to a retail? Does that really make sense for a restaurant where you are dealing more hands-on? But do you have to go to the extreme of what you would do in a clinic or a very personal services kind of environment? So trying to dig a little bit through what that might look like and how that plays into the regulations. There is, as Susan said, there seemed to be general consensus on the count on me NC. I think it's something that we are looking into at DDI and very supportive. I would hate for us to do something so far off that if NCRLA is going to spend the resources to really market that across the state, so that way people, when they come into Durham, they're looking for that symbol, that sign, and they know, okay, there's a standard that is being followed. So recognizing Durham is a little different, but sometimes it might be helpful so that there is safety. People feel safe no matter where they're coming from. People in Durham may know that, but people coming from Apex, Cary, Garner, and we know people travel, and we want those people to travel. They need to make sure that they understand the regulations and won't have really a lot of time to read. No one's going to want to stand in one place and read a long document. And around the outdoor dining, we're working very closely with a group of downtown restaurants on how that works. And I will say that the city has been extremely open and receptive and great partners on that front. I'm trying to get through any of the city regulations. Hopefully we will have something next week. And then on the state side, what our state delegation has done, both Durham, but the other larger cities in North Carolina, this is an issue that we're all talking about and that the downtown groups have been talking about. So we are very encouraged and happy to see that support. And there are 2 bills addressing this, as well as some language in the governor's order around the ABC, flexibility of the ABC board. And Wendy has brought in the Durham ABC board chair. So we're moving. It's, restaurants are very difficult because it is very much about the food you're eating, the experience you're receiving, but then keeping everyone safe. But I would agree that we've got good people on the task force who are committed and passionate about making this work. And then of course the restaurants are going to make sure that they let us know. So that is good that we're not doing this in a vacuum.
Mm-hmm. If I were to add one thing about the type of, one of the biggest areas of question and angst that some of the restaurateurs have expressed is that there are so many potential guidelines for keeping a restaurant safe. And so many rules about trying to keep people apart from each other. They are very concerned about how they would enforce social distancing, for example, in their restaurant. It's one thing to train your staff. And even then it's a little arbitrary, like if you want your waiters to stay 6 feet away, but then they have to deliver food to the table, how do they even think about how to maintain that kind of thing? And then the idea of, well, then how do you enforce it with your customers without seeming like you're policing them and detracting from that experience Nicole was mentioning. So I know that they have a lot of very valid concerns about how this will actually get rolled out and how they can make it work. So I think us continuing to provide support and advice in that area is going to be very important.
Okay, thanks, Susan. Thank you, Nicole. So again, a lot of work to get done over the next week so that we have a good process that we can roll out for restaurants to go through the self-certification process, as well as address the other concerns that have been raised. Any more questions on the restaurants before I move to the next area? Hearing none.
I have a quick question.
Could we back up just a little bit to the growth, the growth we've experienced, unless you're headed back to that?
Yes, I'm gonna come back to that, George. My plan was to kind of go through those those specific things that we need to do for reopening, but certainly go back to the growth and talk about how do we as a task force collectively start to identify what are those metrics that are important to us to help us understand if we're trending in the right direction.
Well, I'll wait until you get there.
Thank you.
I had a quick question about the cost associated with restaurants adhering to the best practices. Was there any discussion in regards to the cost of these restaurants trying to make sure that they're certified?
Not specifically that I heard, just a reference to the fact that there would be cost associated with it. The question has been asked about whether there would be any funds available to allow access to PPE, for example, or plexiglass dividers or something else.
And I'll say that, sorry, here I am. I was going to get some coffee. Sorry. I would say that financing and business assistance is coming up quite a bit, whether it's around the PPE, gloves, whatever, the training, and then just a general opening and what would need to be done to the facility. So financing is something that has been brought up by a few people, but it's much larger than just certification or creating regulations that they would abide by. So it is foremost in not just the restaurants, but all small businesses. What is that assistance going to look like to help them get through this? And that's from PPP recipients to folks who were unable to get PPP and who are still trying. There is still money in PPP, so we're trying to encourage folks to, if they can or are eligible, to go through that. But the financing issue always comes up in our conversations with small businesses.
Maticia, maybe I could speak to that for just a minute, because this is uppermost on everybody's mind. The council yesterday voted to put $1 million into small business relief to go along with the $1 million in Duke University's fund, plus a few $100,000 other dollars that corporate contributors have made to that fund. And so we have asked our city manager, to begin to roll that out in June. We are prohibited by our state government, and the School of Government has been very clear about this, from making grants from our city money. That may not be true from other money, such as Duke University's money, but for our money, it is true. And so we're planning to have a loan program, be a very low interest loan program with either no or extremely low interest over a long period of time. The payback could be over a long period of time. And the council voted to do that yesterday and has instructed our staff to roll that out as expeditiously as possible. I think that we've all experienced some frustration at the speed at which this is happening. It is urgent, and I'm going to be staying on it. I know that our administration will as well. So I wanted to say that that's coming, and that I hope it's coming very soon, and expect it will be coming very soon.
All right. So now I'm going to turn to another area, which is pools. And Brian, I may need your help with this, because I think there's probably been some roundtables that talked about, I know not specifically about pools, but fitness centers. So has there been any discussions at the fitness centers roundtables about pools? Because we, need a certification process for that as well.
There has. Good morning, everyone, and hope you're doing well. We have had a number of different roundtables. The fitness centers met 3 different times this week, and the pools have been in some of those conversations. There is a recognition that there's a great county function in certifying pools already, and that the state, as they have with the other industries that they have started to loosen up in the safer at home phase, has issued guidance on what safety looks like for these establishments. So I would suspect that similar to what the restaurants are talking about, we would be in a strong position to be able to offer some clear self-certification process very quickly, so that those who are prepared to open on June 1st, if that remains the appropriate date, will be able to do so.
Okay, thanks for that, Brian. And then on
I would-
personal, go ahead.
Fitness centers more broadly, I think many of them are also coming up with those standards and would hope to be able to be in alignment with additional phases from the state that affect them. There are some creative conversations going on about use of outdoor spaces in the meantime.
Could I ask a pool question? Mayor Schul, related to the city pools. So sorry if this is slightly off the subject, but I saw that the city pools would be closed for the summer, and this could just be hearsay, but I was told there wouldn't be city rec programs through the summer. And so I was wondering, is that a capacity to police, or or is it a like epidemiological concern?
George, I don't think that, I've heard those things too. Our Parks and Rec department is still thinking about all of those things. There are definitely going to be some rec programs during the summer. They're trying to figure out what they'll be. So I'm not sure exactly why that got reported, about both in terms of the pools and our rec centers, or rather our recreation programs. Parks and Rec is working on that and trying to figure that out right now. So I would say stay tuned to see what the decisions are going to be. They're trying to figure out how to do as many programs as we possibly can. Can we have summer camps? What would they be? All those things are under consideration. Yeah. So those things are still out there, and Parks and Rec is looking hard and trying to figure them out, just like everybody else is trying to figure out their rec and camp programs.
Thanks.
Yeah.
Thanks for that question, George, and the response, Mayor Schul, because George, like you, I was a little confused when I heard the reports about Parks and Recreation closing all pools, and my son's a lifeguard, so he wants to be at the pool. All righty. Why don't we move to personal services? And Brian, I'm probably going to call on you to help out again here on the personal services, because I imagine there's been some roundtables in that space as well.
Sure, thank you. We had a great conversation yesterday evening, and Mr. Boyd, who's on here, has been great in helping organize and lead that group. And so I'm going to put him on the spot and let him start, and then I can add any additional notes.
Thanks. Good morning, everyone. I think from that particular roundtable, and while we're talking about this, I just wanted to make sure that if it hadn't been said, I know a lot of what I'm hearing from all the small business owners that I'm talking to, and small and medium-sized business owners that I'm speaking with, the concern is that they feel that one of the systemic issues as a small and medium-sized business in Durham pre-COVID-19 pandemic had been that there's an illumination of downtown Durham businesses that they don't feel they have the benefit from, and they feel that also has been exacerbated by this global pandemic and eventual shutdown. I just wanted to encourage us all, if you know small and medium-sized businesses that do fall outside of the downtown corridor, that we get them involved in roundtables. The Fayetteville Street corridor businesses, East Durham businesses, and various other businesses where we know a lot of long-term businesses have been sustained in those neighborhoods in Durham for years. Regarding the personal services, barbershops, beauty salons, nail salons, massage parlors, massage therapists, excuse me, and tattoo artists. I think the main concern that came out of that were a couple. One was the fact that just industry, as an industry itself, those business owners felt, I don't know, kind of relegated to the outside. And they say as an industry, they've always felt that way when it comes to the business ecosystem in Durham. And so there was some concern around that. There was a strong mention of rent relief, as Brian can attest. We're hearing at every roundtable. I'm probably on 10 or of the roundtables. I can't imagine what Brian's going through, trying to keep up with 20 plus of them. But yeah, so between the rent relief options, any type of financial relief to just to reopen, were huge concerns. One of the things that came out of from I think it was Achille Hester, who owns a barbershop. He mentioned something that I don't think we had been brought to anyone's attention, and I certainly hadn't thought about it in these terms. But Black males are predominantly his company's customer base or consumer base, and with COVID-19 attacking this population at such an alarming rate, and having said that this population also having such an being overly represented by pre-existing conditions, he had a concern that whether or not, whatever time we opened up, whether or not that population would feel safe even coming into a space where, let's be honest, it's just such a high risk of contraction. And so that was brought about as well. And those are some of the things that I remember specifically. I do know there was another gentleman on the call, Lynn Lilly, who owns 40 Below Barbershop, and he's been in the industry since, I think, 1993, and spoke a lot toward the significance of the Black barbershops within the communities that go far beyond just the financial benefits, and how they're utilized as counselors, as news reporters, as et cetera, and that is missing right now in this time as well. We know often minority communities don't seek out some of the mental health services that they do need, but there are a lot of informal mental health practitioners, if you will, in this case, and we feel like that's a huge gap in those communities currently. I'll pass it back to Brian.
Thanks. I think that's great points that came up. And the only thing I would add to it, and I would just note that this has been present in all of the roundtables that have met so far, is some concerns around liability, legal issues that arise. They are hearing great assurances that the county will be prepared to assist with contact tracing and things like that if and when those issues come up. But between the ramp up of testing and then the associated liabilities that they could experience, it's something that a lot of people are hearing. And I think that we'll look to have some experts help try to address some of those concerns in future meetings.
So hearing some of the concerns raised, especially by you, Ed, and folks may not feel comfortable engaging in these services for various reasons, do you think things like having some type of checklist or certification that you can show would help? It's not going to help everyone, but do you think that would help alleviate some concerns?
I think it would help alleviate some concerns, but I think that it also calls for a checklist that's that can be modified, yes, to your specific culture or base or consumers. And one of the things that, as I continue to talk with Pilar in our various meetings, that making sure that it's in the correct language and terminologies, for whoever is coming. So I think, yeah, I would say I would agree to a checklist, obviously, but I want to make sure it's just not like just a one cookie cutter approach.
Right.
Because we're not hearing cookie cutter complaints or cookie cutter problems and concerns at all.
And I would just add on to that in saying, I think similar to what the statewide Count on Me and See program is doing for restaurants and lodging, I think it'll be important for us to build in some idea of the consumer responsibility. With Count on Me and See, I believe it's called the Guest Pledge. I've already taken it. I encourage everyone else to take a look at that. But I do think it's important to recognize that this is a two-way street. We don't need to put the onus solely on the business owners and employees in safety.
So with that said, for personal services, kind of, what are we really focused on over the next week as we try and reopen by June 1st, if possible?
Yeah, I think it'll be developing what that checklist looks like for this industry. They, like the pools and the restaurants, got guidance from the state. They're also regulated by the state, and so there's pretty good assurances that this industry is has already been trying to go above and beyond the minimum standards. And so I think we'll be working to get that developed. And then I think that we'll try to have resources available to answer questions about liability, about funding issues. They're experiencing many of the same things that the restaurants and other small businesses are, and have people who feel prepared to be open on June 1st be in that position to do so, and help fill the needs of those who aren't quite ready yet.
Okay. Thank you, Brian. Thank you, Ed.
That was one other concern that I just looked at my notes. Someone mentioned a concern that as they see that various places across the world are opening and then having to pull back and shut down again. There was concern that they fought and took so long, many of them, to get unemployment, that if they come out of unemployment and then we have to go back into some type of a shutdown, then what does that look like as far as them trying to get unemployment? One of them mentioned, getting unemployment was like having a job itself, having to get up early, stay on the call forever, things of that nature. And so there was a lot of concern around that. And I think one of the other business owners also mentioned having their employees having to make certain, just having to make financial decisions based on, if they were to give up unemployment and come back to work, and some of them, in some cases, would be making less at work. However, what do they do? How do they, what kind of help or guidance or counsel do they have to make that decision again if things were to go back to let's go back home, and this process starts over again?
Well, go ahead, Susan.
Yeah, if I could introduce a issue for us to tackle, I think this week, that's related to some of what Ed was just saying and what we heard from the restaurants. That is a concern that they have related to what happens if they do everything they're supposed to do a fantastic job. One of their employees tests positive for COVID, or one of their patrons, they find out, tests positive for COVID. Are they expected to shut down and quarantine everyone who works there for 2 weeks? Is there a certain extra process of disinfection? What are the expectations? And certainly a situation like that is widely known is going to be out in social media. It may hurt them anyway and prevent others from wanting to visit. I do believe this task force should help them define what would be the expectations so that they can feel that and patrons can be reassured that that's a safe business to re-enter.
Thanks for that, Susan. And I think you and Ed gave me a perfect segue into our next topic, which is to spend a little bit of time talking about what are those trends, what are those metrics, what are those things that we do if we were in the situation that you raised, Susan. If a business were to have a case, then what happens? I think George had a question or a comment on that. So I'm going to start with George to find out what his question or comment was before we start the conversation.
Well, I was wondering, Wendy mentioned there'd been an uptick in the Latinx community. But I just wondered if it was, other than that, was it obvious where that unexpected growth had come from? Was it congregate living, or was it across the board? I was just curious. Does anybody know?
I think the best person to answer that would be Rod. So I'm gonna punt that specifically over to Rod.
Good morning to everyone. Great to see everybody. George, to answer your question definitively, we don't know. We do know that we have increased our capacity to test, and that's a good thing. And like I said to the members of the MAC call so many different times, it truly is a gift and a curse, because it truly lets us know what's really out there in our community, and that's what we want to know. However, it's a good thing because you have more access to different testing sites and testing capabilities. As mentioned, we did indicate that there was a heavy influx uptick, if you will, in the Latinx cases. But as I've talked to my great colleague, Dr. Akinboyo, it normally takes about 2 weeks to really determine what's really trending. And that's fair, because you can't begin an initiative in the very next week, expect results. So again, when we take a look at the triangle area and where we are and heavy influx in and out, it's a number of different variables, but we just know right now that we are seeing an uptick. It could be attributed to different industries. It could be attributed to testing. We just have to continue to monitor to see what it actually is. But to answer your question, we're exactly not sure, because it's not been too long since the governor reopened the state under phase 1. And in Durham, we followed a week later. So again, with this information coming out, it's a little too soon.
Mayor Schul.
Thank you.
Thanks, Rod.
Thank you so much, Rod. And we get, we've got a lot more information always coming on the county data hub, and I urge all of you all who have not been able to look at that to please do so. But here's one of the key things I think we need to know, George. And I really think this is an important job for the task force this week. If you look at what the governor's key metrics are, one of the most important metrics is the percentage of people testing positive. That's the way that you know that your tests, whether or not your increase in cases is being driven by more testing, or whether there's something else that's happening. And we don't really know that in Durham. We know the number of tests available to us, and we know the number of positive cases we have, but we don't know the actual number of people we're testing every day. And I know this is pretty complicated, because Duke is testing, and Lincoln is testing, and CVS is testing, and Walgreens is testing. And it may be that I know that there are issues in terms of getting that information back from the state and so forth. And we don't need an exact number of tests if there's some estimating that needs to be done. But I really think we need to know the percentage of positive cases that we're getting out of testing. And so I would just urge the task force to take that on as something important. And one of the things when I looked at the data hub last night, in terms of our Latinx community, our cases, 34% of our cases now are among our Latinx community. That's a big number. And I know that Pilar has been working on this. There's been meetings this week. Rod's done a great job of really, with our public health folks, increasing our contacts and education in Spanish. He's getting 5 contact tracers who are Spanish speaking. All these things are great, but I do think that we need to continue to think about, that seems also to be, for me, a big priority this week, is to think about what other things need to happen in the Latinx community. And just the other things that I think are priorities for the task force in terms of data include, people have already mentioned the fact that our restaurants are going to need PPE. Our other businesses are going to be needing PPE. I don't think we have a good sense yet of what the community need is going to be. We know it's going to be more, but is there any way to quantify, or, you know, certainly not to get an exact number, but to have some sense of what that means? I think we've traditionally been thinking about that for our frontline workers, for our health workers, but now I think we have a whole another group of people who are going to be really needing that on a regular basis. And I think we need to understand that need. And I also think that in terms of the contact tracing, we're doing a great job of increasing that number, as Rod described to us last week. But how many of those do we really think we'll need now? When I thought that the question that Susan asked was really important. Suppose there is something that happens in a restaurant. I know we've heard from Rod, they're going to put a contact tracer on that. They're going to figure that out the best they can. But what does that mean? How much of that are we potentially going to need? And then finally, the other thing I think we need, and here's where I think Dr. Akinboyo can help us and others, is some sort of expertise in interpreting the data and telling the story of what it means. Because I think George's question is the question that so many of us have. You've got more cases. What does that mean? I think if we had the information about the percentage of positive tests, that would help us. But I just think we need to be able, I've tried to do this in my messages to the community, listen to Rod, listen to the Duke folks, and then explain what it means. But I think that we need people to help us do that. So those are some things that are on my mind when I think about what our needs are this week.
May I add one thing? This is Herbert Davis. I totally agree with what had just been said, and some people brought it to my attention. As we're sharing the data, if we can make sure that we're sharing it around racial dynamics so that the populations that are being drastically impacted will know that it is impacting them, and that might be of assistance in keeping them from wanting to go out or pushing for freedom to be out and willy-nilly.
Just to piggyback on Dr. Davis, I was actually writing this down as well. How we communicate out that data is key, and I think Mayor Shule pointed that out. I think some of the things, I've been on calls with people that are totally confused, but well-versed on the information. And I think to George's point, one of the confusing pieces is when we attempt to explain an uptick in our numbers by saying it was a prison population outbreak or a retired living outbreak, then many people feel like since they fall out of that category, that there's some sense of safety that they actually don't have. And so I think while explaining these upticks, we also need to be clear that, these reasons, right? And so I think we just need to be clear about that as well.
I think for me at least, one key data point is how is our healthcare providers, how prepared are they? How many hospital beds do we have? Because my understanding of these stay-at-home orders was all about making sure we had adequate care for those who were impacted and affected, not necessarily stopping the spread. So to make sure that we have enough capacity to treat those who are stricken, I think that's a key data point too. So making sure that we have an understanding of that is important.
One of the challenges with testing is we don't know how many people we should test. What is happening right now, say at Lincoln, is we are only testing individuals who are symptomatic. So that automatically implies that the percent of positives are going to be higher than if we tested, just routinely the entire population. So that is a challenge. And I don't know what metrics we can come up with to resolve that issue. So I wouldn't be too alarmed at the high percentages we're getting, because people we're testing are people who are more likely to end up with a positive outcome. The other issue around PPE is that in general, say at Lincoln, we've done pretty well with PPE, but then there's one area like gown. So to paint a picture of how we're doing, I would say we're doing well, but then to understand where the shortages are in the system is challenging. The other area where most providers and businesses are struggling with is hand sanitizers, not the ones that are available at dispensers, but smaller ones that you can give to individuals to walk around with in their pocketbooks, so that they can practice good hand hygiene whenever necessary. And then in terms of looking at vulnerable populations, we have no idea what percentage of the vulnerable populations are struggling with getting access, say, to masks or hand sanitizers and those kinds of things. So I think we should try to figure out how we get those things to those vulnerable populations. At Lincoln, everyone who comes in that doesn't have a mask, we give them a mask. But now we're not doing outreach into the community to look at the individuals who are not coming in. It's almost again like, who tests.
To follow up,
go ahead. You go ahead, Ms. Lois.
No, thank you. I was going to say, it sounds like we're talking about qualitative and quantitative metrics. Part of it, it's the stuff, but it's also the knowledge and information. And I know often that's more difficult to, to collect. So again, it sounds like we're talking about some very qualitative things, as well as how do we ensure that people have the information and information systems and networks that they need to support each other and to understand what they need to do.
So I'm going to ask, because I know, as Katie mentioned, we have a very packed agenda, and I've run over just a little bit. So I'm just going to ask the task force this question. Who on the task force wants to rally together over the next week and spend some time doing some analysis and be able to report back on things that we think we need to really focus on and how we gather that information? Can I get a few folks to volunteer to take that on? And I know many of you are involved in many roundtables. I heard you loud and clear, Ed.
I think we actually had a few folks. I think Rodney, Dr. Akinboyo were working on some of this and tasked with working on some of this in terms of coming up with the metrics and what we need to focus on. So maybe we can have a few others who might be willing to help them with that, although we may also want to pull in some folks who aren't on the task force who may have some expertise as well. Dr. Akinboyo, is there anything, as you're listening to this, from your expertise that you wanted to add?
Yeah, so I was just, good morning, everyone. Some of my other roles had some conflict this morning, but I'm here now. Thank you again for having me. Just a couple of quick things. I think there are answers that are easily available for some questions with the North Carolina Department of Health and Human Services. So I think at some point we all need to ensure we are using some of the resources that are already available as we create our own locally specific resources, because I do agree that we have a unique set of issues somewhat, particularly with just what our population makeup may look like as compared to some of the other counties, and our testing strategies may be different. Some quick specific answers: when there is an outbreak or when there's an exposure, and sorry, I have a slight echo on my end. So when there is any local exposure, we have standard guidelines from the CDC and the health department as to how to perform tracing and who needs to shut down, who needs to be isolated, and who can come back and when. That may change, and I think 2 days ago the CDC just released something else, but they have pretty strict criteria for how and when a business shuts down. While I'm sure the PR or the verbiage around this may not necessarily be the best for a business, it's important to remember that the transmission could go either way. So a patron could come to a business and expose everyone as compared to the business being responsible. So the business is being safe by shutting down, and is the community coming in to use whatever service they're offering may be a risk of exposure to the business and their owners. We can say this here. I know the way people react to that, it's a little bit different. In terms of who to test, when to test, there are newer guidelines for our state, and they've broadened it pretty significantly. Previously, we were testing symptomatic patients for us, but even just people in the community. That has changed, and there has been an increase in testing just household contacts regardless of symptoms. And I think this alludes to all the comments about what the data is showing, because if some of our local other counties are testing asymptomatic people and people in the household, if everyone has broadened who they're testing, their rate of positives will likely go down. And I'm fully supportive of the idea of some self-certification, or making sure people are taking some ownership of what just the 5 or 6 things that you need to do, and you have to ensure that everyone that's coming to your facility is doing, and making sure that stays on for a little while. I think those were the major areas I'm hearing. There are lots of other issues that sort of reflect back to both metrics and how to reopen safely. Some of the limitations with using data will come into play, because every time we present data, we spend a lot of time talking about the limitations of data. And I hear sometimes the discrepancy there when we say we want data, we need data, and yet we discuss all the limitations around it. But that's sort of the nature of epidemiology and trying to make decisions with a moving data point.
Also, I'd like to add that Dr. Akinboyo and I, we did speak this week in reference and preparation for this. And I just want to speak to testing. And I just want to make sure that we're not giving or being asked with something that we are incapable of doing within a week's time. Public health has always been focused on the number of positives. That's just the way things have been. What we're being asked now, statewide, globally, is to focus on positives and negatives. So we're really having to be challenged and to be creative in trying to obtain both positive and negative tests. So the Department of Health and Human Services have been doing an admirable job of trying to get this information. I won't bore you with a lot of information, but for the most part, Dr. Zach Moore, who's a state epidemiologist, has indicated that that task involves contacting every laboratory that does tests and requesting positives and negatives. And that's not an easy feat, and that's not something that we've been doing. In addition to making the request, you have to have the personnel to extract that information, compile it, and put it inside. They did indicate that they are close. They said probably within the next week and a half to 2 weeks, they should be able to present county by county data of the total number of tests done within that county. It's important for me to tell the task force this because, again, if we are given the task of coming up with something for Durham within a week's time, we may not have the time to do it or the capacity to do it. I know, and I dare not speak for Katie, but I know Katie did indicate that Duke does have that information for Duke. But as she also mentioned to me, it's truly not representative of the entire community. So I just wanted to pass that on to the group as well. In terms of race and ethnicity, again, I continue to implore you all to promote the Data Hub and to go to the Data Hub, because every time there's a topic or something that we feel would be prudent for the community to know, we put it out there. And most recently, as of yesterday, we have updated it for race and ethnicity. So again, Mr. Boyd, if in fact there's a certain population that really wants to know how they're being affected, they can go right there. We put it inside a nice little pictograph and they can see over a 3-month period how they've been affected. Also, there are 2 tools that are coming out that I feel will be critical for Durham residents, Durhamites. There's going to be a tool called Know My Status, which will allow them to utilize the tool to assess how they're feeling and whether or not they may need to be tested for COVID. There's another tool that's going to be called Find My Testing Site, which will list all the areas, all the testing sites within geographic area that will tell them exactly where they can go for a test. These things are still continue to be inside the production phase. Right now on the state DHHS website, you can go and find out where your testing site is, but they want to make this more mobile and put it in the form of an app so people can always do that. That's going to help with businesses. You know, again, somebody knows that they test positive, whatever have you. Again, what Dr. Akinboyo said, you know, again, data can promote, data can disappoint. But for the most part, we have to rely on the data. So we're going to do the best that we can to continue. But it's important that I say what I said about the testing, because I don't want to give false expectations or whatever. If this is some information we can obtain, we will definitely bring it back to the task force. But it's important for the task force to know that there's a possibility we'll say we just don't have access to this information.
Rodney, thank you for that. And I just want to say, as I was pushing for us to get metrics over the next week, it's really, I think a lot of what we need is some of what you just did, is education and awareness. And I want us to be realistic about what we can deliver. And, you know, if there are things that we can't get done over the next week, that's fine. I just want us to move with a sense of urgency and, again, educate us and make us aware of the data that's already out there, because we certainly don't want you and Dr. I'm going to say her name wrong, Akinboyo, creating new data just to be creating new data. Let's leverage what's already out there, and, you know, just go from there. So by no means was I implying that you guys need to come up with everything by next Friday, but I think by next Friday, just being able to report back on maybe there are some things that you guys think are very important that we really need to focus on. And if it's already out there, just helping us understand that it's already being reported and where we can go to get that information.
Maticia, I just want to jump in real quick. I know we need to move on. This has been a great conversation. Related to data, what I hear when I'm listening in on some of the roundtables is that people are looking for that scorecard. I know we've been talking about this for a while, and again, we're getting back to some of the barriers that he's had, that he's referenced. But I think what I'm hearing from the community is that people want to know and again, we know the metrics that Dr. Cohn has laid out, and you know that when she does her press conferences, it's the green light and the red light. And I think that the community wants to know what are the 2 or 3 things that we're really going to be looking at, and that people could go to the data hub and see that green light, red light, and to know, okay, how are we doing? Things are going well, or when we know we have something to be concerned about. They want to know what are those few key metrics as we reopen that we're able to measure, and so what is that measure of success? Really honing in on that for Durham is what I'm hearing. The other thing is related to PPEs. I know it came up, the mayor said we need to understand how many PPEs do we need for our small businesses, but I think the other issue is how are we going to make these accessible to people? Again, I want to stress the equity issue around PPEs when our businesses are already stressed. It's an extra expense for them to then try to go out and get them. Are there solutions that this task force can recommend around access to PPEs? So I just want to throw those 2 things out there.
Thank you for that. I'm going to, so again, like you said, Commissioner Jacobs, great discussion. But due to our agenda, I'm going to move us along. So next on our agenda, I think Brian was going to give us an update on the remaining roundtables that we haven't already talked about.
Yeah, we got a chance to talk about a few. I'll note that we have also continued to have great meetings with the places of worship. And after I give the rest of my update, I'll give Dr. Davis just a quick moment to give his perspective on that. But his leadership there has been tremendous. We are starting to move into, now that we've addressed some of these areas that will be behind the state on reopening, we are starting to have more conversations with these broader industries, some of which have been operational or at least partially operational this whole time. So we had some great meetings of the child care and summer camps. Dr. Akinboyo in particular was a great addition to that. Next week, we've already got plans for lodging, retail, and small businesses more broadly. And so I'll be getting that information out to the task force and continue to welcome your participation. I think that we will see the Sports Commission take the lead on some of the sports conversations moving forward. And I anticipate another busy week where hopefully we can continue to get, and we appreciate the support so far from the county health department, not just Director Jenkins, but thank you for bringing in some of your staff. I do think that people will want to, the business owners and want to hear and want to be able to tell their employees that the state guidance is something that we can feel confident in, or if there are additional measures that they can be taking, but they do want to hear that from the health side, not be trying to come up with it on their own. And so really appreciate the support that your department has offered so far. And then but before I kick it over to Dr. Davis, I would just say that as we figure out a little more rhythm with these roundtables, we will have briefing materials out to you all in advance of these meetings moving forward. So Dr. Davis.
Thank you, Brian. We've had 2 meetings, and so far they have been very productive in hearing from different perspectives. This past one on Wednesday, we actually increased our group. We almost doubled in size, and we're still looking to continue to expand. So if you yet know of places of worship, leaders that would like to participate, have them contact us. We're not turning people away. We're not trying to be exclusive. We're trying to be open. And one thing that I will say is that the decision that seems to be bubbling up is that we probably will be looking at possibly 2 documents, where we'll have one, which we mentioned last time, that united statement about, places of worship that are not planning to open. But we do have people who have expressed either at the round table or expressed to me privately in messages or texts that they may not be able or are not willing to sign that at this time. So our decision, as we're still crafting that language, will probably be that that'll be a sign on individually. And so it won't, even though it would have been developed at the round table, it won't necessarily come from the round table. It'll be an individual places of worship that choose to sign on. Because we're trying also to make sure that the round table is a place that is welcoming to all, even if they have a different perspective. But what we do believe we will be able to get sign on from everybody with would be the second document. And it may be a second document or it may be an addendum to the first one, but it kind of goes in line with the self-certification. We talked about a document of best practices and what would need to be done as places of worship are opening up. And so I was taking notes, so we'll take it back. I don't know if we'll use that language of self-certification, or just best practices, but that we're in that same vein of how we can inform places of worship. And then I'll say this and I'll be finished. Even though we've probably had about 15 to 20, what we are finding is we still are having a great impact where the people who are present yet have connections to others. So even though all may not be at the table, we're hoping, and that's why we're trying to drive home, having best practices, what needs to be done if and when they do decide to go back in, so that we can at least try to say, hey, if you're going to do it, here's how we advocate going about doing it. And Ryan's been very great helping us with that, and Brian. So Rodney was on, he spoke to us and gave us some good information that was helpful on this past Wednesday as well. But what we're looking forward to continuing, and like I said, I do think even though we have some differing perspectives, we've done by the grace of God, we're yet a welcoming environment that's keeping people willing to participate, even though they might view things differently. Thank you.
Anything else, Brian? Or is that it?
Unless anyone has any questions, happy to keep moving.
Okay.
Great.
All right.
Thank you. Thank you so much. So I'm going to pick up here with our review of progress made to date, and we specifically pulled out priority areas 1, 2, 5, and 6. 1, as you'll recall, is our metrics, and we've already had a lot of discussion on that. So unless folks have anything else to add there, I'm going to move us right into PPE discussion. That's all right? All right, and I know Ed and Jody have had some discussion around PPE. Can you give us an update on the work you've been doing?
Sure, and Pilar actually has been great with input as well. I'm going to just give a quick overview of the reporting and then answer each question so that I stay within our time limit. The overview, we have been charged with the responsibility of developing plans for securing enough face coverings and any other PPE deemed necessary by our public health experts for all businesses and residents. We have identified our needs, a proposed timeline, and established a skeleton of matching solutions. The evidence shows that we must plan for our immediate needs, which will be the next 30 days, as the state and Durham will soon move to phase 2 of their respective reopening plans. We must also have plans for our short term, 30 to 90 days, our midterm, 3 months to 1 year, and our long term, 1 to 3 years, as our ultimate goal is to have a master plan that provides us covering, no pun intended, in the absence of a vaccine. Coupled with face coverings, masks, and other PPE, we identify the need to include widespread public health campaigns to ensure all businesses and citizens of Durham understand the importance of these protections in our lives. Along with the widespread public health campaign, in the short term, our skeleton of matching solutions includes an immediate procurement process to obtain the face coverings and/or masks that deem themselves necessary for Durham's safe entry into phase 2 of its reopening. In our short term, we will rely on a combination of furthering the procurement process and beginning to identify local manufacturers as to continue to provide face coverings and masks while we ready ourselves for the midterm. During the midterm, we will drill down on partnerships with women and ethnic minority-owned businesses to support a local entrepreneurial ecosystem of face coverings, masks, and other PPEs. For long-term, Pilar and I have established expectations around relying on this women and ethnic minority-owned business ecosystem to create a host of jobs for the citizens of Durham while contributing to the expanding its tax base, as we would then find ourselves circulating the funds around PPE entrepreneurial ecosystem completely within the County of Durham. Question number 1, what progress have you made over the past week? Answer, by way of progress, we have vetted 23 companies and their subsequent supply chains. All of these companies and their supply chains were judged based on their ability to meet our needs, timeline, their quality of product, price points, and a thorough examination of their paradigms and processes around equity. For our immediate needs, we have identified a local Black woman-owned company that is an international PPE supplier and has the capacity and bandwidth to fulfill our needs. In fact, my first conversation was a phone call with the head of the company while she was in Maryland on Tuesday, securing PPE for a contract she was fulfilling for the state of Rhode Island. Eva Perry is from Durham, and her company, Carriox Solutions, confirmed that they could meet our needs. In fact, they could deliver in upwards of 1 million masks within a 48-hour time frame. Ms. Perry also met with me yesterday in downtown Durham, utilizing social distances, of course, to ensure that I had samples to show you during my reporting this morning. Unfortunately, in my rush to get coffee, I left the samples upstairs, but I do have them. Number two, what are your priorities for next week? We're sorting through countywide businesses and residential demographic data to figure out our exact face coverings and mask needs per CDC guidelines. And we seek to move forward with urgency in this procurement process. Pilar and I have agreed to continue working with and identifying the additional women and ethnic minority vendors and manufacturers that will build out the pending workforce and ecosystem needed throughout our timeline. 3, any obstacles preventing you from making progress? Answer, we have not currently identified any glaring obstacles that may prevent us from making progress. 4, do you need any additional resources or guidance? Answer, we need to talk with, I assume, Chairwoman Jacobs and Mayor Schul so that we could move with urgency through the procurement process and fulfill our immediate needs. And that's it.
Excellent. Thank you so much. That is a tremendous amount of work in a week. So really, really impressive. And I am sure that Commissioner Jacobs and Mayor Schul will be happy to work with you in terms of that procurement process. So that's great. Thank you. Let's move right into number 5, which was around engaging the community and some type of community roundtables so that we are not only solely focused on business roundtables. And Lois, can you give us an update on that work, please?
I will give a little bit more context and then have Ed and Pilar chime in as well. Several of us on this task force have communicated quite a bit with the support of Amber this week, sharing information about organizations, groups, networks, and individuals we ought to be involving and engaging as we seek to make sure we provide, a format in some meaningful and productive way to get general feedback from the broader community around their concerns and their needs. We will be meeting this coming Wednesday again. And I believe Ed has a little bit of the written report from the meeting that Amber hosted for us on Wednesday, which I was unable to attend that meeting. But to date, we've collected a lot of information, have been reaching out to individual networks and compiling a list of individuals, particularly for well-established grassroots community-based organizations that we want to make sure that we get input from throughout Durham around what would be most helpful to the community at this time.
Excellent, great. Any specific additional help or support that you need at this point?
At this point, I think probably just engaging individually folks on this call and again, reaching out to networks. I think for me personally, one of the questions is in terms of formats to get good feedback, in the same way that Ed's spoken quite a bit, and I know a number of us on the call have been reaching out to folks. How do we best compile information? How do we bring people together in a way that's meaningful for them, and how to share that information in a productive way? So, but again, I will yield to Ed because I wasn't on the call with Ed and Pilar on Wednesday to see if there were other things that came out of that call that we should note here.
Great.
Quickly, same format. I've got a brief overview and then the questions answered. Within the overview, we've been charged with the responsibility of expanding the task task force engagement beyond the industry or sector-specific roundtables that are currently ongoing and being moderated by the Durham Chamber of Commerce to include community-rooted partners and residents. I want to make it clear that this task force understands that there is no need to reinvent the wheel here. African Americans, Latinx, and other ethnic minority communities, like all demographics, have built existing methods of effective communication, organic and formal leaders and leadership, along with communally accepted ways of relaying information within and coordinating with communities outside of their own. Subsequently, it is not our objective to establish any. Instead, we seek acceptance and partnership with this task. We seek their acceptance in the partnership with this task force and with respect of their community's norms, mores, and customs. We're committed to a mutually appropriate line of communication. Number one, what progress have you made over the past week? Pilar, Amber, Lois, and myself, we met with several guiding questions for our meetings to help us think through the process of ensuring effective communication between the Durham Recovery and Reopening Task Force and the many community-rooted partners and residents of Durham. We've begun to reach out to the citizens of Durham directly through personal and professional networks via text, email, and social media to initiate lines of communication. Our initial goal is to obtain and seek the counsel of the citizens of Durham as it pertains to how COVID-19 global pandemic, quarantine, and subsequent shutdown has affected their lives. We have already fielded tens of emails and phone calls that have provided us rallying points of departure from which we will begin our efforts and focus our concerted energies. Number two, what are your priorities for next week? We are currently compiling an initial list of community leaders, and identifying already existing networks of effective communication. We are with urgency considering our target audience, those who have traditionally been left out of these conversations throughout Durham, mainly African American and Latinx populations. Three, any obstacles preventing you from making progress? Currently, we have identified one glaring obstacle, that being various language barriers, but to that question specifically, we do not think it will prevent us from making progress. Four, do you need any additional resources of guidance? Answer, at this time, we seek guidance and/or additional resources, whichever the case may be. We continue to engage in conversations with citizens in which they speak of a need for rent relief. And honestly, as an action-oriented task force member, I am at a loss for guidance on this point, and I have not yet been able to identify any adequate sources of aid. And that's the end of my report.
Is there anyone on the task force who can help with that around the rent relief?
Katie?
Yes.
This is Steve. Yesterday, the City Council heard at our work session that we'll be using $950,000 of our CDBG funds for rent relief. This will be allocated at our next Monday's meeting, officially voted on 10 days from now. The money isn't here yet, and it's the federal government. It'll take a little longer to get out than we would like, but that won't nearly do the whole job, but it is a very good, it's a nice chunk of change that we can add to attacking this problem. Excellent. I do also want to add one other idea and thought for you all, for this group, Lois and Ed and Pilar, and that is, please use the services of the city's Neighborhood Improvement Services Department, Constance Stansel. Constance has volunteered her services. She called me and was explicitly said to please offer her services. They have done a wonderful job through our equitable engagement process of going out into communities, and they have staff that can help, and it's what they do. And so please use their resources, and they also particularly, we have funds we have city funds that pay partners in our community who are community rooted. They are critical partners in all of our engagement now. So I think they could be a really great resource for you all.
Great. We'll reach out to Constance.
And I just want to jump in about rental assistance. The Board of County Commissioners approved $90,000 for a COVID housing fund that is available until, this is just for May and June. So this money is available to be applied for through Department of Social Services, and it is specific for rental assistance for COVID-related economic issues. So please make sure that people know about that resource. Thank you.
Excellent. Thank you so much. Anything else to add from that group? Excellent work. Great. All right, and the last group reporting out today is really around forming a communications team to develop strategies for relaying information to businesses and residents. Susan, do you want to give us an update on that?
Certainly. We have done a good bit of work in starting to lay out a structure for what we would be seeking to accomplish and put that underway. We've got 3 pillars of what communication needs to accomplish. One is centralizing information sharing and creating a one-stop resource for the official messaging as much as possible. And I know the scope of which messaging we're talking about is going to be important for us to clarify. But right now we have messaging that's coming out from a lot of different sources. Second is sharing clear and consistent messaging about Durham specific guidelines, clarifying what's required and versus what's recommended for opening, for example. And the third is increasing the frequency of official communication to provide as much transparency and consistency as possible. We have identified prospective committee members that we would like to invite to this effort and plan to have a kickoff meeting for that work on Wednesday next week. We have not sent out the invitation, so if you are looking forward to being on it, don't worry, you haven't seen it yet. And we have a outline of a plan, and that committee will come together and flesh that out further to define more specifically what the goals are and what the scope is. We've discussed the fact that in communicating to the business stakeholders and organizational stakeholders and also the residents, this could be a multi-million-dollar public awareness campaign, and that's not what we're expecting that we're going to do. So we do need to define what kind of scope is going to meet the needs of Durham and its constituencies, and be very flexible and nimble in being able to respond as we see the need for information to get out in different areas. So in forming this committee, one of the important things here, moving into the resources that are required, and that's an important first early step for this committee, is defining what kind of resources we will have on the committee. We've learned from experience that there are 2 groups of people who join communications committees. There are the people who are great at providing oversight and input and reviewing content when it gets done. And then there are the people who actually create the content and do the research and the writing, the graphic design, the web design, media relations work. And we're going to be really clear in making sure we understand who are the people who are happy to provide the input and who are the ones who are going to be doing the work. And that affects also what kind of budget might be necessary. The more people we have with the specific skill sets around web design, media relations, graphic design, copywriting, and videography and photography, the smaller our budget needs to be. So we actually had some discussion about whether perhaps there are some communications folks in some of our private industries in Durham who could devote a person half time to this initiative for the next few months, so that we can get this work done. But those are conversations that we want to have, and then we can come back and have an idea about which of these services and then what out-of-pocket expenses do we need to budget for, because I know that defining what kind of budget's needed will be important. And right now we're looking at it a sort of high, medium, and low level of communication support, and that too depends on how we want to define the scope. So our intent is that this committee will meet next week. We will flesh out the goals and then come back to the task force and share what we're thinking in terms of goals and scope of what this group will be doing. And by the week after next, we should be in a position where we can lay out more specifically what the plan is and the timeline, which is not to say nothing happens for 2 weeks, just that at that point we should be able to articulate with some clarity about what this team is setting out to do and get some feedback to understand where specific needs are. We know with all these roundtables, for example, and these work streams are all different, and what kind of communication support they're going to need is a little bit different. So we'll need to be responsive to each one of those content areas. And then let me ask if Ryan and Marielle, who are part of this, also have things that you would like to add.
Marielle or Ryan, do you have any additions to that? Great report.
Susan, I think you did a great job summarizing. Marielle, do you have anything?
Nope, agreed. I think you hit all the points, Susan. Thanks.
Okay.
Excellent. Well, that's terrific. All right, those were our updates for today. Why don't I turn it back over to Maticia to wrap us up with next steps?
Yeah, so we're actually doing really good on time. And so since we are doing really good on time, I know we have a full agenda, but I just want to ask the task force, are there any other topics that you want to talk about right now? We have about 5 or 10 minutes that we could dedicate to that. I see George and Dr. Davis.
Go ahead, George.
I just wanted to mention sports, we haven't had a roundtable. I doubt we'll get to it until the first week of June at the earliest. So I'm not trying to put the cart before the horse, but at some level, I'm not really here to represent the Durham Bulls because I don't think there's going to be any baseball this summer. But as chair of the Durham Sports Commission, I want to watch out for recreation, which is why I asked the question about the pools earlier, and summer rec stuff through Parks and Rec. But I also want to watch out for amateur athletics in general. So and so we'll get to that. I'm not trying to rush us into that, but I do want you to know that in the governor's order this week, and it's section 9, if you read that stuff, there's a specific addition now to sports. And there's some ambiguity around it, but I think it's designed primarily to allow the universities to play on television. So it would allow teams to congregate and they could play a game, but there could only be 20 spectators. And now the way it's written, it raises the question, could we host a baseball tournament at the DAP or at the DBAP? And right now limit spectators to 10. But over time, could we advance that number? Anyway, those are unanswered questions that I have, just within the last day, put to the city manager, and I don't know how the new Durham order incorporates that part of the governor's order, or if it does at all. But I just wanted to mention to y'all that that was going on. There's a lot of interest in the amateur sports community about resuming competition, resuming tournaments, and they aren't too worried about spectators. But they would, they'd like eventually a number high enough to accommodate some parents. That number is probably bigger than 10. So I'm just putting that out there. I mean, that doesn't need to be dealt with now, but that's the kind of thing I'm concerned about. So thanks.
We incorporate that in our local order specifically, George. We took the governor's order, and it does have a larger number than 10. I think it's 25, but we did incorporate that.
Thank you.
Thanks, George.
The two things that I've heard that people have asked me to bring, number one, and I don't know quite where they footfall, but number one, the limited, excuse me, the limited access to technology, the internet and equipment. So being aware of that, that can have an impact. Those impacts can fall around racial lines, but then also one that I was not aware of, the reduced bus schedule is presenting challenges to people who are trying to find and keep employment. And even some that are trying to remain civically involved and engaged. So those are two things that were brought to me, and I just wanted to bring them up here. Thank you.
Yeah, the transportation
I had
issue
one
is
comment.
very,
I had one quick comment. Only have a second.
yeah, the transportation issue is really important. At Lincoln, we provide some transportation services. When we are fully staffed, we have 4 vans. But now with the social distancing, it's presenting a whole new challenge that we never had to deal with historically. So I'd love to hear some ideas from members of the task force as to how we should move forward.
And there has been a request for a transportation roundtable. So another one on Ryan and Brian's list.
Yeah, I can speak a little to the situation with transportation. We have had to cut back our transportation a lot because the bus transportation, because of lack of drivers. That has been the determining feature of why we haven't had as much bus transit service as we usually have. We're getting back to a higher level now. Then I wish I can get you some. I'll get the roundtable some more specific figures on that. But the other limiting factor when we do have enough drivers and enough routes is that we have social distancing on the buses. And I believe that we're now limiting every bus to no more than 16 passengers. And so that has meant that we've had some routes where we've had people we haven't been able to put everybody on the bus on some routes. And so we're now running trailing vehicles on the most heavily used routes, a vehicle that comes behind and tries to pick those people up. The city transportation staff is well aware of the problem that you all have identified, and we're really worried about it a lot. The one area where the city did get significant funding is going to get, hasn't gotten it yet, but will get significant funding from the federal government is in the area of transportation. We'll get a significant input of funds. So our system is going to be solvent, but we're getting, and our drivers are coming back, but we all know the need and are very concerned about it, but there's a lot of work going on around it. And I agree the transportation roundtable of this group, I think would, it doesn't, not necessarily led by someone on this group, but that is organized by this group would be really important.
All right. Well, thank you very much. I'm going to talk a little bit about next steps. So before I do that, I just want to say thank you so much for everyone joining. Thank you for your engagement. Thanks for all the great work that you guys have accomplished over the past week. It feels like we've accomplished a lot, but we still have a lot to do. So in terms of next steps, we still have a list of action items from our first meeting that we're tracking. So I'm not going to cover those items. I'm just going to cover the things that seem to be most important coming out of this meeting. And that's not to discount any of the other action items that you guys may have spoken about. But really what we want to get accomplished over the next week or so, the next week, is making sure that we have a self-certification process that we can roll out for our restaurants, our pools, and personal services, and trying to hopefully have that finalized by next Friday so that we allow these businesses an opportunity to do the self-certification before June 1st. So I would say that's a focus area over the next week. Also, I think Rod agreed that he would finalize all metrics by next Friday, right, Rod? And I say that jokingly, but really over the next week, spending some time, having some conversations on the metrics. And, I think what's really important for us as we think about the metrics is trying to define first and foremost what's our tolerance as we reopen in terms of, increase in cases, like trying to come up with some type of tolerance, because right now, and I'll just speak for myself, I almost feel like I'm operating kind of in the blind. Like I don't know what's good or bad. So I think that's a focus area, as well as some of the other areas that we talked about, just trying to understand the percent of positive cases coming out of testing, the uptick that we may be seeing in the Latinx area. And Rod, Dr. Akinboyo, I'm happy to engage and help you guys over the next week if you let me. So I'm happy to assist as best I can. So those are the focus areas that I think we talked about for the upcoming week. Did I miss anything?
Hi, Maticia. I don't think you missed anything. I was just going to add one thing to keep on our radar. I think one thing I was struck by when I listened to the roundtable on childcare is no matter how much the childcare owners try to comply, I think kids are rather unpredictable with social distancing. And there seems to be a lot of concern about how they can safely reopen, even if they do their best to meet all of the criteria that we've put forth. And that's something that I think going forward we can work with and accommodate for in the communications that we push out. And then particularly, we're learning more and more about kids and how this would impact them, including the multi-system inflammatory syndrome that there've been a lot of reports about. And those are things that we may not be able to accommodate for. So I really appreciate what you said about encouraging everyone to have some flexibility here. And while we put out some objective measurements, we may have to pivot and change things as we learn more.
Absolutely. You're exactly right. All right. Well, I think that concludes our meeting for today. I'm actually going to give you guys back about 8 minutes. I hope you use it wisely on this Friday.
Maticia,
Ryan.
Yes, before everyone goes, Amber, I don't know if you are prepared to put up the slide, but we do have a new email address that residents or anyone in the community can use. And there it is, rrtf@durhamnc.gov. So all of those emails will be read. They will be shared. The kind of comments will be shared with task force members and with our elected leaders. So we're encouraging, if you have questions or anything that you want to share, this is one email address that we're encouraging everyone to use so that we can have all of those communications in one place and provide good reporting up to the task force of all the questions and concerns. So thank you.
Thanks for that, Ryan. All righty. Well, I hope everyone enjoys your Friday. Be safe this weekend. Enjoy your Memorial Day.
Everyone have a great week.
Thank you.
Thank you for everyone's really hard work. Appreciate it.
Thank you all.
Thank you.
Bye.
Thank you, everybody. It was wonderful. What a great group. Thank you.
Thank you, everyone.